Dr. Singh, can you give an example of a component versus a solution?
My analogy for this is that we always think in terms of construction. We're reconstructing something. And so on a larger scale, you might be familiar with building a house or something like that. So you have to put in proper foundation and you have to put in enough of a foundation, but that depends on what kind of house you're building on top of it. So if I was building a one-story bungalow, I might have certain requirements of that foundation, but that won't necessarily be the ideal solution for building, let's say, a 3 or 4 story building on top of it. So if I were to go to our architect and say, how much is the foundation going to cost me? He'd look at you and say, well, what are you going to use it for? What are you going to build on top of it? Are you building it on swampland, or are you building it on good quality ground, etc.? So he would be hard pressed to give you what the cost of a foundation is unless he fully understands what you're trying to build on it. Similarly, in our case, we're hard pressed to give you the cost of what this implant is going to cost, because that's the foundation for what we're building. So we're hard pressed to give you a cost of what that foundation is until we understand what's the quality of your bone. Is it good solid bone? Do we have to do anything in particular before we replace the implant? Do you need additional grafting, etc.? And what are you trying to build on it? Is this a single tooth? Is it part of a bridge or a denture, or is it part of a full mouth reconstruction? It's absolutely true that the final solution is going to be successful if it's well planned and it meets the needs and the requirements of that patient. So both what they need and what they want has to be served in the final solution.